Okay, well, all right, guys. Well, we can go and get started. So, first of all, it's great to have you guys here, Dave and Jerry, back. I think again on Rehab Power Hour. And so, um, would you mind maybe just reminding me kind of where you guys are calling from and how things are going so far?
Okay, so we are calling you from St. Louis, Missouri. Sherry had stroke in February. So around the first, late May, we got this device that she has no active movement in her right arm or hand at all.
Okay. Okay.
So obviously we'd like to kickstart that process.
Okay. Yeah. Well,
And
remind me,
feedback for
how
you
long have you guys
as far as how
been?
the
Oh, go ahead.
device is working. She'll finish or be doing her session, and I'll say, "Do you feel like you're moving it?" And her attitude is, "I don't know."
Okay. Yeah, yeah. I think this could be a tough one simply because if we don't have all of the sensory systems in play,
Sure.
um, it can be really hard to know whether or not we're actually moving or not.
Mhm.
And that's why the visual feedback there in terms of it's sort of as a surrogate for those sensations that are there normally. So I think that is something just to be aware of. It's entirely normal to have those impaired sensations. So I don't want you guys to think that you guys are out in left field and alone in
Mhm.
that sort of fashion. So one thing that I want to ask maybe you guys, if you guys are doing this, how are you going about doing the individual activities? Is it primarily just with the one side there and just doing the motions, or are you doing any sort of bimanual activation with the other side as well?
We've got an eSTEM device, which I am using on a multiple times a week
Okay.
process. She does go to therapy every day, so she gets occupational therapy. I'm not sure how much they're using with her right side because the attitude seems to be chicken and egg.
Mm.
Until movement, we can't really work on movement.
Yeah, you're exactly right. There is kind of a chicken and egg problem there. And I think the thing that I was bringing up is that there's this concept of using the less impaired side or the stronger side
Mhm.
to step in and provide some sort of analog for those sensations. And so you can kind of imagine it like the approach with that mirror therapy takes, where
Right,
you
which
have
we're
both.
doing that as well.
Okay, very
Yeah.
good, very good. So you're very familiar with that, and the interesting thing about mirror therapy is that it's actually kind of tricking your brain, thinking that that more impaired side is actually moving. The cool thing in this situation here is that in our case, we don't have to trick the brain, right? We can actually just use the Motus hand to physically move us through those motions. And we can also simultaneously use your less affected side to walk through and provide sort of a model by which those movements need to be recruited. So I will often encourage people to do that sort of bimanually.
Gotcha.
So yeah, that's just something to be aware of. And the other kind of nice thing is I always give the recommendation that it's not simply just the number of repetitions that you do, right, or the hours of therapy you do. It's also the quality, right? It's kind of two sides of the same coin. And when you have to think about, well, what is quality? Repetitions is something easy to think about. Well, it's just a number, right? Pretty easy to conceptualize that. But effort and quality is maybe a bit harder to kind of understand, even for scientists and clinicians, I think, hard to quantify too. And so, one way I like to think about this and try to get people to understand is that um, before your stroke, if you thought about moving your hand up to try to, let's say, pick up a cup of coffee, that's my old analogy because I'm always drinking coffee here, my old metaphor rather. So, if you think about trying to pick up this cup of coffee, you can then recruit those various neurons to do that. But you have to think about it first. And you're thinking about the process the whole time while you're recruiting those muscles to go pick it up and execute that task. The same thing has to happen here when we're doing the actual tasks in the robotic system. It's not simply that you can put the system on and have it move you through the motions. You have to be consciously aware of what it's trying to ask you to do. And you need to be trying to be effortful in doing that. It's even if you don't have great active movement, little to no active movement in your case, Sherry. So I think it's something really important to do. And that's kind of a happy byproduct of doing bimanual, right? Because you're already kind of forcing yourself to think through the motions. And then you're getting that sort of assistance with the Motus hand to kind of step in and provide that help to actually execute it. So I think that would be a good recommendation to kind of
Okay.
really make sure that we're getting the quality in addition to the number of repetitions and kind of the hours.
Okay.